The other massive thing that has kind of slipped in on the side is this specialized food provision for children from the age of 0 to 5. There is this whole industry that produces specialized so-called child healthy food. But if you go back 100 years, children ate what adults ate when they came off the breast or came off formula. So there was none of this intermediary, this is healthy for children type of food. And unfortunately, it's become predominantly carbohydrate based. And that's why we're seeing this incidence of insulin resistance in 5-year-olds. And I know Dr. Kajee has a tremendous experience, both personal and in her practice, about how to raise your child healthy. And in fact, what's pervasive for me about this discussion so far, Prof talked about it, you've talked about it, I've talked about it, is the ultimate thing that makes us human, which is this, our brains. So Dr. Kajee, won't you share some of your experience about what recommendations and what thoughts there are for that early childhood exposure as you transition a child away from formula and breast milk to eating real food? What negative things have happened, and how do we resolve that and resolve some of the diseases along with that, the ADHDs, the allergies, the obesity, that type of thing?
Thanks so much, Rob. And thanks, Prof. Neville. You know, I mean, the thing is, I think I'm an adult doctor, so I'm an internist. I've trained to see adults. And when I ran the high care unit, most of my patients were cardiac patients. And I was doing the morbidity mortality for our department. Being a tertiary facility, we were getting all the referrals. And I remember doing it time and again and thinking, who experiences the end result of poor health? I'm the one who is putting a lot of emotion and effort and trying to teach my patients. Some of them don't make it, and some of them do. And so whose responsibility is this to be able to inform and educate? And I firmly believe it's the people that, you know, in medicine, we specialize and specialize and specialize, and then we're just hyper focused on one speciality, but that needs to inform the collective. You know, the public health needs to be informed by the people whose hearts are breaking while they're actually trying to fix the problem. So, you know, for me, I'm coming from the background of an adult medicine doctor, and meeting the children of my patients who are already obese, walking in with packets of crisps and cool drinks. And, you know, it feels like there is more education at the moment for the general public. People are doing all these online group classes and people are really trying to get healthy. But the one thing that really irks me is that we've got this mindset shift of adult health, but we completely ignore children.